Hello all. Welcome to what I hope is first of several Facebook Lives with me, Katherine Fletcher, the MP for South Ribble. Before I start, I have been asked to deliver a message from Boris Johnson, Prime Minister, to you all, and if you bear with me, I'll read it out. Dear communities of South Ribble, I know how difficult this is. In just a few weeks, everyday life in this country has changed dramatically. We all feel the impacts of this, not just for ourselves, but on our loved ones and our communities. I am humbled as Prime Minister to see what has been going on around the country and in South Ribble, as communities come together to support the vulnerable and volunteer to aid others and the NHS. We have now had over 750,000 people sign up as NHS volunteers. There is such a thing as society. Thank you. Please keep going with your efforts. We can get through this together if we all follow the guidance. Regular hand washing, and most important of all, we all must stay home to protect the NHS and save lives. Thank you, Prime Minister Boris Johnson. Okay, thank you for that, South Ribble. What I propose to do is answer some of the questions that have come in already. I've got a lovely team of people helping kind of pass comments. So if you want to ask a question live, if you comment in the comment box, that'll get passed to me and then I'll answer it later. But there's 2 or 3 that have come in already. So I'll start with those if that's okay. Lots of questions about Foreign and Commonwealth Office support for nationals stuck overseas. I understand the Foreign Secretary is making announcements in the next hour or so. Can I suggest that you watch that when he's talking about repatriation flights, and any details will be available in the travel section of my website, which is katherinefletcher.uk. The links are on the Facebook page. You can find it later. What we've done is put an awful lot of sections in there within specific guidance and support. And you may hear me mention it a few times because I propose any questions that I can't answer today, we'll take away and put on the email, put on the website. What's up there is all the latest government advice. I've got a great couple of people helping me out. As soon as a government announcement comes out, it gets put on the website so you can access it anytime. Okay, first of all, lots and lots of questions about working and the difference between the shielded group, the self-isolating group, and the group of people that should be socially distancing. This is one where perhaps we could have done a better job of communicating it, but I hope people will be understanding. The pace has just been unbelievable in Westminster in the last couple of weeks. We have published, based on the scientific guidance, a very specific list of businesses that must shut. These are businesses where the likelihood of lots of people contacting and spreading the virus around means that we really need them to close. What our current policy is if you can travel to work, and provided, and this is important, your employer is applying proper social distancing and hygiene techniques, so that's being able to work 2 meters apart, having regular access to either soap and water to wash your hands, hand sanitizers, potentially protective equipment, but not necessarily needed. You can and should, if you can, do that work at your employer's site if your job doesn't allow you from work from home. If you can work from home, you must work from home. I've had a series of follow-up questions about that, what to do if employers can't maintain social distancing. And again, this is something that I may say a few times. I have had reports and people have been emailing into me saying my employer is making me go to work and they're not maintaining social distancing. If that's the case, I need specifics. So if anyone with examples such as that would be kind enough to write into my email address, which is, again, I will put it in the comments, but it's katherine.fletcher.mp@parliament.uk, and we'll widely share that email address. What I've been doing when I've had concerning reports is actually ringing employers up directly or seeking guidance. So I hope that covers that one off, and maybe we'll return to some of the specifics in the comments. Summer exams for children. You'll have to forgive me, I need to make a note. Summer exams for children. Lots of people saying what's going to happen with my children's GCSEs or A-levels that have been set. All of the detail is on my website, But in essence, what the government's done is asked Ofqual and the exams boards to come up with a process within the detail that allows children to be assigned a grade based on their previous performance and work. Now, those grades are not going to be isolated within schools, so we're not going to allow one school to give everybody fails and another school to allow everybody to give A stars. These are going to be centrally moderated on a typical kind of graph for a grade distribution. But crucially, when those grades are awarded, they will be absolutely the same status as grades that previous years have achieved when passing exams. There will also be an appeals process where you can say, I don't believe the grade that's been assigned to me is appropriate, and you will have the opportunity to resit an exam and show your performance that way. But obviously the timings for that are still to be worked out entirely based on what the medical advice is for the situation at the moment. I hope that one helps. Okay, Ian has asked, what steps is the government taking to get people back to work once they've had COVID-19? And this touches on an area that lots of people have been asking questions about, which is testing. So I don't know whether you guys know I've got a biology degree, so you will forgive me if I nerd a little, but I think it's worth understanding. So the current testing regime, of which I think we're up to about 120,000 tests at the moment, is a antigen test. So it's testing for the presence of the virus in your body. Are you spitting virus out at a given point? The problem with testing for the virus is if your immune system gets on top of the virus and you're not producing viral load, especially slightly further down in the path of the disease in people that perhaps have milder cases, it's really hard to get a positive. It's not the most accurate test in the world. And also that test, where they take a nasal swab, requires going back to a lab to go into a big clunky machine, a PCR machine, and then it comes back. So those tests are available for everybody in hospital, and with the massive ramp up in capacity, those tests are now going out to NHS frontline workers. So if you're isolating because you believe you've got it, we can provide that test and either allow you to isolate properly and come out the other side of the disease, or actually say to you, oh, fantastic, you haven't got it, so that you can come in and support the effort in the NHS and care homes, etc. That's absolutely our priority, to get those people tests. In terms of getting people back to work on a broader sense, what that requires is an antibody test. And an antibody test says, okay, so your immune system has been exposed to the virus, and what it does is allow for us to understand that you've got the antibodies in your blood. Now, that test, we've bought millions of these kits. They are commercially available and they're in the UK. But as the Deputy Chief Medical Officer, Jenny Harries, said the other day, what we absolutely can't do is have a test that doesn't work. It's absolutely crucial that any testing that we do does not give a false positive, i.e. it says, yes, you have had coronavirus, when in actual fact you haven't. So those testing kits are being evaluated at the moment, and they will only be released when we're confident, or more specifically, Public Health England is confident that these tests work. Because as she said, there's only one thing worse than no test, and it's a bad test. So as soon as those tests become available, people will be able to have the antibody test, understand where they've been exposed, and if they have been exposed, then they will be able to go back to work. And that's part of the path out of this disease for us as a nation, but also for individuals as well. So I hope that's answered your question. We've had a question from Anita asking about the capacity and availability of ICU beds in the NHS at the moment. As I'm sure you guys have heard before, all of the social distancing and stay-at-home techniques that you've been asked to practice is all about making sure that the NHS doesn't get overwhelmed. And as of the last report I saw last night, whilst there are hotspots where they're getting quite full, at the moment there is more capacity in the NHS ICU bed than there is demand at the moment. That's, as Prime Minister Johnson has said in his letter, it's going to get worse before it gets better. But Anita, in answer to your question right now, yes, there are spare ICU beds, both within Lancashire and across the country. Anita also asked about facilities for drivers to wash their hands. This is an interesting one. So just to explain how we're operating in government at the moment, there is a 10 o'clock call every day open to all MPs with the Cabinet Office, where we can raise questions and concerns or suggestions that are coming in. That then goes through into the ministers, or we can raise it direct with the ministers and then we get an answer. And over the last 3 days, this point about drivers being barred from washing their hands and maintaining the kind of social distancing and protective measures has come up repeatedly. I don't have a direct answer for you because the guidance is still there. We've asked all of the motorway service stations to stay open, and they are still open to allow people to do it. In more private settings, I'm awaiting the guidance. So be assured we're on it, but I don't have a definitive answer for you yet. What I will do when I do have it is either post an answer in the comments below, or more likely I'll put it onto my website, katherinefletcher.uk, and you can find it there. Self-employed. So Shelley has asked, she's self-employed within a partnership, and whilst the overall group's profitability is over £50,000, her share of it is under £50,000. Now, to remind people, this is the brand new scheme that we've put in place to support self-employed people, where they will be able to get the same support as the employed, up to 80% of their profits, registered profits, with HMRC over the last 3 years. Shelley, I think the answer to your question is yes. I've not seen any guidance that suggests that because it's part of a partnership, there's any difference in the liability. It's about what you've registered with the HMRC in the past. But what I will do is take it away to the Cabinet Office call that I've just mentioned and double check, because it's quite a specific one and it's a very new scheme. So I hope that gives you some confidence, but I will double check. If you want to be able for me to give you a direct answer, if you want to email in katherine.fletcher.mp@parliament.uk, then as soon as I have the answer, I'll be able to pass that back to you. Right. I've had a few people, and I think it's a legitimate question. Lots of people suggesting that we're perhaps overreacting to the virus. Subsets of that. Alan suggested that there's a risk we're shutting down the economy for no reason, and this is no worse than seasonal flu. On this point, I'm confident to talk from my own experience. So as I said, I've got a biology BSc. I'm a member of the Science and Technology Committee. And the first briefing I went to on the coronavirus topic was the 22nd of January with Professor Chris Whitty, who, as an aside, Professor Whitty, the Deputy Chief Medical Officer, Dr. Harries, and Sir Patrick Vallance from SAGE, as a scientist, they are some of the most impressive scientists I've ever met, and we are really lucky to have them. We're not overreacting. What's happened is the virus has basically lost a quarter of the outside of it, if I put it really simply, and that quarter has been swapped with something from a different species, a different type of animal, and put in. And that means that no human being has got immunity to it. That's why it's spreading so quickly. And like anything, and forgive the nerdery, but it's all on a bell curve. And what that means is that there are certain people that are going to be very seriously affected by it. Believe you me, if we weren't taking these measures, some of the modelling that feels outlandish, we're saving lives, and I'm really confident to say the measures that we're putting in place is all about saving hundreds of thousands of lives. I shall draw you some complicated pictures, but we are not tanking the economy for no reason. What we are doing is trying our absolutely level best to make sure when we get through this, and we will get through this, that our economy is ready to bounce back in rude health and take the opportunities. And that's why we've made such unprecedented measures as 80% of salary support up to £2,500 for employees. The same same for the self-employed on what they've registered as PAYE. Unprecedented the coronavirus business interruption loan scheme, which allows businesses to access interest-free loans for 12 months, all underwritten by the government. That's because our commitment to supporting the economy is second only to our commitment to saving lives. Right, I think it may be time to head across to some of the questions that we've got coming in. You'll have to forgive me, I'm on a screen here, so I'm just kind of running across. So Andrew's asked, how can we get involved and help people, and what groups are out there? So on my website, what I've done is a run round where I've tried to list all the volunteer groups that we can find within South Ribble. It's in a section called Help Volunteering, and I will post the links to this into the Q&A chat. Lots of people would love to receive a phone call. Lots of people might need a bit of help getting shopping, or perhaps running to the pharmacy. What I must stress is what the scientists and the Prime Minister are stressing. Only do that, and do that with all love, because we're just a wonderful community, but do it safely. Repeated washing of hands, adhering to the social distancing. And the most important thing you can do to help save thousands of lives is to stay at home and to absolutely minimise your contact. As Dr. Jenny Harris, the Chief Medical Officer, puts it, preventing house-to-house transmission is the single most important thing we can do to squash the peak, allow the NHS to have the capacity to be supported. And I know that's a message you're hearing repeatedly, and in some ways it's painful, and in some ways it's easy to do, but by all means do that. And then if you feel you can do it safely, supporting your community would be absolutely wonderful. And thank you to everybody that's done it. It makes me so super proud. They're really, you're just wonders, you really are. Right, and another Andrew asks, what criteria will be used to lift lockdown, and what will the steps be? Andrew, I'd love to give you a detailed answer, but this is something of a moving feast. We need to understand the number of people in the population that have had it and are now immune, and that refers back to the antibody test that I was talking to you about, and that test's under evaluation now. And as soon as we know it works, there are millions of those tests available, but we can't put them out until they're there. Ultimately, what moves us forward is a vaccine. And as a member of the Science and Technology Set Committee, we have received some really quite interesting representations from scientists working on, there are broadly 3 different buckets of different types of vaccines that you can put in. You know, there's some remarkable stuff going on at great pace, but we either need immunity or a vaccine, and to put a timescale on that at this stage is not something I'm capable of doing. I would say that Dr. Jenny Harris is very clear and articulates it better than I do with all of her years of expertise. So I would encourage you to listen to those press conferences, especially the Q&A at the end. And if you're out working or out helping someone, my website is putting the whole of every day's press conference up on a video, which via YouTube, that you can watch and pause and come back to and check stuff. So I'd encourage you to do that. Deb has said, why has the government flouted WHO guidance, and why isn't there enough PPE? The WHO guidance, Deb, if I take that one first, the WHO guidance is primarily aimed at countries across the world. It's flat guidance. So some countries don't have the wonders of our NHS. And the guidance from the WHO is aimed at countries that perhaps have slightly less sophistication in their medical centres. So it's very much a baseline. What we've got with, let's face it, the best thing that the Brits have ever invented, in my humble opinion, which is the NHS, is an ability to kind of flex that and allow the scientists to make specific calls that balance these trade-offs, saving lives first, and then making sure that there is an economy that we can kind of continue to use afterwards. So I can't gainsay those scientists. I don't have the expertise, but I can tell you that they're really impressive people, and I trust their advice. And I believe we're very, very lucky to have them. To your point about PPE, yeah, the NHS is wonderful. What it's not brilliant is at logistics. And so there's been PPE available, and it's been in place X, and it needed to get distributed to place Y. And I'll robustly defend them for not necessarily having that capability. In the last 24 hours, we've actually drafted the army in to start moving PPE around the country. And I know that I've had specific requests coming into me on my email, which is Katherine.Fletcher MP at parliament.uk. And I have a mechanism to raise any specific gaps with PPE and get people the cover that they need. So I've spoken to local care homes in Penwitham, for example, where they were struggling, and, you know, I can raise it and it moves through. So it's there. Not all of it's in the right place. The army's helping. But if you've got specific areas or specific sites that don't believe they've got enough PPE, if you can email it into me, I can then raise it within the local forums and you know, and kind of make sure that they get put down on the delivery sheet. Let's see what else we've got. David, I hope I've answered your question about are we overreacting. George, is it true that the nurses are being allowed to part free? Yes, absolutely. Really important. Don't have the details of the scheme, but if any of you have got NHS or caring professionals that have got any concerns about it, if they email in, I'll find out exactly how they access it. I'm not sure whether it's a sticker in the car or whatever. You'll have to forgive me the detail of that once passed. But yes, it is free because they are doing an amazing job and literally have our lives in their hands. Thank you to anybody who's actually in either the nursing, medical or caring professions. Personally, I hugely appreciate it. That's the thing with this disease, is it just doesn't differentiate. It doesn't matter who you are. You know, the Prince of Wales, Boris Johnson, you know, Baldrick in the regions, we're all at the same risk, and it's only the NHS that's saving us. Thank you. Let me go through. James Samuel, is there more support for those running businesses expected? James, that's a bit generic for me to answer. I mean, it's genuinely unprecedented package of measures. I mean, £330 billion is about 15% of GDP. And that, what's that? Well, in the Second World War, we were spending 20% of GDP every year. I mean, just to put it into context, it's an enormous figure. So the Rishi Sunak has said repeatedly, we will do whatever it takes to get through this. And certainly, personally, I've seen the evidence of that, both in policy making and a willingness to adapt policy to make it happen. So just if I give you a live example, so you get a sense of what's been going on down south. I attended a briefing at 4 o'clock last Tuesday about the coronavirus business interruptions loan scheme. And there were some details there that I felt would make it difficult for people to be able to access that funding. At 9 o'clock at night, I was on the phone to the Treasury ministers, and by 12 o'clock the next day, the policy had been updated to reflect not just what I was saying, but what others were saying. And that's the kind of pace and speed that we've all been operating at. So I hope that one answers. If there's something more specific that you require, please email in. I hope some of you on the call will know I've been phoning around local businesses to help point them into specific areas. We're starting to get to the next level of detail now, where advice for one person is perhaps not quite the same as advice for the other. And that's where I'm here to help, hopefully. Zoe is concerned for the North West Ambulance Service. And can we do more to get them better PPE? Zoe, if you've got specific examples, let me know and I'll raise it. The ambulance service is going to be absolutely vital here. So they deserve and will get the PPE. If there's a logistics issue to getting it to them, let me know and I will play my part to sort it. Robin, what more can be done for recently established small businesses? Robin, I'm going to struggle to answer that without specifics. I apologise. But if you email in, I'll do whatever I can to support. Just to level with everybody, what we can't do is help every single person. There just hasn't been the time. There isn't the ability to formulate policy. We're already having to stagger the help for employees in the furlough scheme and then immediately follow that up with the support for the self-employed. So self-employed, 80% furlough will get paid at the start of June. It will be paid retrospectively all the way back to the 1st of March, but the capacity is not necessarily there for new schemes, if that's what you're getting at. If it's about specific advice and guidance to get individual businesses, small businesses support, by all means email me in. That's my job, and I will, if it needs raising with Cabinet, if I can answer the question directly, I'll answer it directly. I hope that helps. Oliver Wood, when will there be a charity rescue package detailed, and will it cover the largest charities in the country? Oliver, I don't know the details of it, but the Paymaster General on this morning's teleconference said that there's actually live policy being developed to support the charitable sector. And there'll be something coming out, hopefully in the next 48, 72 hours, something like that. So it's an area of concern. We're aware of it. I'll do my damnedest to help them if they need it, but we may just need to hang on a couple of days just to support, just before I can get the details of that support. As I've said previously, if you want that detail when it becomes available, it'll immediately go up on my website, which is katherinefletcher.uk in /coronavirus, and then it's within the subsections of that. David's asked, what about Oxford University prediction 50% have already had the virus? To be fair, as I last saw it, we took evidence on this at the Science and Technology Select Committee last Wednesday. I believe that they've already revised those figures to say that they'd made some incorrect input assumptions into the modelling, and have changed. Speaking personally, as a biologist, I find that very unlikely, just because there's quite a set ratio in the way the bell curve works of people that get it with no symptoms, most people that get mild symptoms, to people that get it quite seriously and need really good help. And those ratios are relatively well established from the international scientific collaboration and global data sharing. So I don't see why the UK's kind of genetics and population would be different to other countries in that respect. So I think they've withdrawn, but if you've got to follow up again, email in and I'll happily get you the detail. Adrian says, should the remaining teachers have PPE? I understand that in the next 24 hours, we're going to be releasing specific guidance for NHS care workers, public sector workers, on what the appropriate level of PPE is for any given situation. So rather than kind of bumping my Facebook Live gums on that one, I will go away and double check and pull it back out and put it on the website as it comes up. But again, any specific concerns, do just email in. Can we please ask the government to clarify where supply teachers fit into the government plans to assist us during this crisis? They seem to fall in between employees and self-employed. Can they be furloughed by their agents? Yeah, I'm happy to clarify. If they're on PAYE, if they're being paid on PAYE, yes, they can be furloughed. If they're not, then there's another package of measures to support. And again, my website's got hotline numbers. If they've been paying into the system and paying national insurance for a couple of years and they've just got themselves caught in a very specific gap, there's JSA and JSA opportunities to help. If they've not been paying in, then there is an improved universal credit package available. Without understanding the specifics, I don't know which one of those people would go on to. The best thing to do is speak to your employer who puts your pay slip out for furlough, or contact the Department of Work and Pensions. Why aren't Michelle's asked, why aren't support measures equal for everybody? Better paid employees shouldn't get more than badly paid employees. Michelle, I'm not totally sure what you're getting at. I mean, we're paying up to 80% of everybody's salaries. That's the same ratio for everybody, up to a ceiling limit of £2,500 a month. So certainly anyone that's been on a salary that would pay them more than £2,500 a month, they're not getting anywhere near 80% of their salary. They're coming down. So forgive me if you've misunderstood the question, but actually I think fairness is at the heart of what we're doing. That's why there is a £50,000 limit on self-employed profits before accessing the self-employed kind of equivalent support scheme to the furlough for PAYE employees. Frank is asking, why is the procurement for PPE and ventilators taking so long? Frank, it's not for PPE, it's not the procurement. There's millions of these things. It's the distribution, because it's a logistics challenge, which is why we've asked the Army to come in and help. And if you look at my Twitter feed, there's some quite impressive statistics that the British Army are putting out about what they're doing. In terms of ventilators, the procurement, I think they're doing quite a remarkable job. I mean, you've seen the Dyson one. They've literally taken an existing ventilator apart and re-engineered it, along with the Formula One teams. And I know the UK Ventilators UK, which is a consortium of huge manufacturers, have all divvied up, making up the parts and the capacities running through. Would it be wonderful if we had 100,000 ventilators sat around? Yeah, but I think the efforts of industry pulling together is it's getting quite close to chucking a load of people in a shed with some pipe cleaner and out they come with a Spitfire. I think they're doing a very good job, including BAE Systems as well, actually. Shout out to that to that local business that's absolutely pulling its weight. Charlotte's asked, can small businesses that are newly established not have their projected profit considered for the self-employment support scheme? Charlotte, that sounds like quite a specific technical question. Could I ask you to email in, because we're not ruling anything out when we say we'll do whatever it takes, but we've done the big stuff, and then we're on a kind of series of diminishing returns within the pie, and that sounds like maybe one we need to take offline and just get into a bit more. Robin's asked, what figures from tax returns will HMRC use in their calculation for self-employed? Will it be gross average income over 3 years or net after expenses deducted? In which case lower paid workers will be adversely affected. No, so it's the net income that you declare on your tax return as a self-employed person that's the basis for the calculation. So I used to run my own business, and say I'd taken £20,000 in the year and I'd had £10,000 worth of expenses, I would put those two figures in and I would pay tax on the £10,000, and it's that figure. I hope that answers your question. Michelle's come back. What I'm getting at is that why should some receive £2,500 and some receive £500,000 or £1,000? Michelle, that's based on what they're earning at the moment. So we haven't got the policy levers or the time to start to make nuanced decisions within this extraordinary and unprecedented package. So there's a fairness question there, which says, why would we give everybody the same figure? And I am also a Tory. So I think, 80% of what you're earning up to £2,500 means everybody's being treated the same, but we're not putting some kind of equalisation on it. I'm sorry if that doesn't answer your question, but for me, this is about, one, saving lives and making unprecedented measures to save thousands and thousands of lives, and two, ensuring that when we've come through this, and we will get through this, that we've got an economy in a position where employees can go back to work. That's what the furlough scheme's about. It's about saying, we'll help pay to hold your job open for you, so when we right ourselves, you can go back to work. And we've applied that similarly to the self-employed. We want Britain to be able to boom out of this if we can. Timescales, I don't know, but the great British business public will foray forth. She says, vaguely doing a terrible impression of the Prime Minister. Anne, please can you give more information on where care workers in care homes will be tested? It's worrying as these old people are very vulnerable. And I completely agree. I completely agree. As soon as we've basically built 2 massive sheds in Oxford to put these big chunky machines called PCR. It's called polymerase chain reaction. So PCR machines to allow for the ramp up of testing. An absolute priority is NHS care and caring staff to get them those tests. But remember that they aren't the be all and end all. They will only tell somebody if they're sick that they actually are sick with coronavirus. So we're really waiting for the science to catch us up with the antibody test, and then that's the game changer. And I think a couple of weeks ago, Sir Patrick Vallance was describing it as the game changer, and scientifically it is. But you have to remember that at Christmas, nobody in the whole world had heard of this thing. And to create an antibody test, you need to understand the virus's RNA code. You need to then design it. You need to then understand what the human body's immune reaction is to it. You need to understand what antibodies the human body produces. And then you need to create a test to do it. And given that we're within touching distance of that, fingers crossed, and it's being evaluated at the moment, within 3 months is a genuinely remarkable effort, and huge credit to the scientific community across the world that have worked to make that happen. Really, I'm genuinely in awe of them. Alexandra's really worried about her grandparents with no way of getting them food shopping and no sorts available online. Yes, this has been repeatedly raised, and I've raised it on the Cabinet Office call. People that have historically used online shopping are getting swamped out because lots of other people are using it. Rather than handle your specific grandparents' concern here, I have mechanisms to refer them to local support. So if you email me, katherine.fletcher.mp@parliament.uk, I will make sure that their contact details get into the space where people can help. But I would also encourage anybody that's listening that's worried about grandparents who maybe need someone to pop out and do a bit of shopping for them. The warmth and generosity and just general brilliant humanness of some of the communities in South Ribble is evidenced by the list of organisations that's on my help and volunteering page. And I'm sure there are more that we've missed. If you want to contribute one, please do let me know. There's the opportunity to reach out for voluntary support, but there is an organisation set up called the Local Resilience Forum that also will be helping to kind of triage people that need extra support, and hoping the two together can really make a difference to people that are worried. And the fear, is not to be underestimated. If you worry about putting food on the table, let me be clear, the Prime Minister has made it clear in his letter to all the homes in the nation, the government's job is to help you put food on the table. So any specific questions, please do email in and I will do my best, but we're here to help. Right, I'm going to try and just do the next few in the next 5 minutes, but if you believe this has been a success, I'm really happy to do another one. I'm aware that there's no way I will have answered all the questions in 45 minutes that everybody in South Ribble has. Several general questions about, no supermarket deliveries. We know that the individual supermarkets are making efforts to identify what they call vulnerable people and give them priority delivery slots. What I don't want to do is talk to the operational detail of that, but people are really thinking about it. And you can imagine it's quite a challenge. So near term, let's pull together, or if I'll help and step in and find support. But the supermarkets are also really stepping up and doing their bit and trying to ring fence deliveries for those that need them most. Jason says, do we have to apply for the self-employed earnings grant, or does a letter arrive in the post? Jason, if you've got no income in, you can apply for universal credit, or as I've mentioned, if you've been paying into the system, JSA may be more appropriate. I will need to double check whether you apply. What I want to say is actually HMRC will be writing out to you and contact you directly because they know who the self-employed are based on previous tax returns. So assume that's the answer, but if it's not, I will post a correction in the comments on this thread, and I'll also make it clear in my help for employees and the self-employed section on my website, which is a link I'll also share. But I think you will get contacted directly by HMRC. And then I think there's so many comments on this. Wow, I'm really delighted that everyone's this interested. Let me draw the live questions to an end. But again, as I said, I'm really happy to do another one if necessary. So I think I've mentioned the website repeatedly, so I won't do that. Just to remind anyone that's joined late, I will post this video onto my Facebook page, and you can watch it all the way back from the start again, and post questions, and we'll harvest those questions for a future session if necessary. What I do need to say, so I've spent, as you can imagine, many hours on the phone, and I did phone around the schools the last Friday. And oh, thanks very much for calling. That's really appreciated. Yes, we need that. And I took it away. And they said, Katherine, what you've got to remember is in Lancashire, we are world class at KBO. And with some trepidation, I said, KBO, keep buggering on. And if nothing else, this crisis teaches us that being world class at KBO is Lancashire's kind of secret advantage. So to emphasise the Prime Minister and to amplify the Prime Minister, please stay at home, protect the NHS and save lives. But in Lancashire style, KBO. Thanks very much. Bye.